Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. This week, Congress did something that has become increasingly rare in Washington. It passed a major government funding bill, bipartisan too. And buried inside that bill are a number of health policy decisions that will directly affect patients, from telehealth and hospital-at-home programs to drug pricing middlemen and public health funding. But the bill also raises some questions. What does it mean to give more money to federal health agencies in a moment when many patients, clinicians, and advocates are deeply concerned about the direction of health policy coming out of the Department of Health and Human Services under Secretary Robert F. Kennedy Jr.? Today, we're going to walk through what Congress actually passed, what's in it for patients and providers, what didn't make the cut, and why some lawmakers and advocates are worried that more funding without guardrails could do real harm. Let's start with the basics. Congress passed a large spending package that funds much of the federal government, including the Department of Health and Human Services, through the end of the fiscal year. This bill helped avert a prolonged government shutdown and sets the operating budget for many health agencies Americans rely on every day. For healthcare, this bill is notable because it does several things patients and providers have been pushing for, often unsuccessfully for years. First, it extends Medicare telehealth flexibilities. These were originally created during the COVID-19 pandemic and allow Medicare beneficiaries to see their doctors virtually from home. Without congressional action, many of these flexibilities would have expired. This bill extends them again, giving older adults and people with disabilities and rural patients continued access to care without unnecessary travel or disruption. It also extends the hospital-at-home program. This allows eligible patients to receive hospital-level care in the comfort of their homes instead of inpatient facilities. For many patients, particularly those with chronic illnesses, this model has improved outcomes, reduced infections, and increased comfort. The bill extends this program for several more years, providing stability for health systems that have invested in it. Additionally, this bill continues funding for community health centers. These centers serve millions of patients, particularly those who are uninsured, underinsured, or living in medically underserved areas. While advocates continue to push for longer-term funding certainty, even a short-term extension helps prevent sudden clinic closures or service reductions. Fourth, the bill includes funding to continue implementation of the No Surprises Act. You'll recall that this law is designed to protect patients from unexpected medical bills like out-of-network charges after emergency care. Without continued funding, enforcement of these protections could have stalled. All of this is very meaningful. For many patients, especially those already navigating fragile access to care, these provisions matter a great deal. One of the most significant patient wins in this bill involves pharmacy benefit managers, or PBMs. We've spoken at length about PBMs here on the Health Advocates. They act as a middleman between drug manufacturers, insurers, employers, and pharmacies. For years, patients and independent pharmacists have raised concerns about opaque pricing practices, spread pricing in Medicaid, and incentives that favor higher-priced drugs. This bill takes several important steps to rein in these middlemen. It prohibits PBMs from charging Medicaid more than they pay pharmacies for drugs, effectively banning what we call spread pricing in Medicaid. It requires greater transparency around PBM contracts and business practices, and it begins to separate PBM revenue from the list price of drugs in Medicare Part D, instead allowing PBMs to collect clearer service-based fees. So what does this matter to patients? Because PBM practices can directly affect out-of-pocket costs, pharmacy closures, and whether patients can access the medications their doctors prescribe. These reforms are not perfect, but they represent years of advocacy finally showing results. For patients who have watched drug costs rise while access shrinks, this part of the bill is a real step forward. So, now let's talk about what didn't make it into this legislation. Most notably, Congress did not extend Enhanced Affordable Care Act premium subsidies. These subsidies would have helped millions of people afford health insurance through the ACA marketplaces. Without extension, many families could face significant premium increases or are simply priced out of coverage altogether. Lawmakers largely avoided this issue because it requires tough negotiations and long-term funding commitments. But for patients, this omission is not abstract. It means higher costs and more uncertainty in the short term. The bill also avoids codifying several controversial health policy proposals coming from the Trump administration and HHS, including proposals around international drug pricing and broader structural changes to the federal health programs. We'll discuss more about these proposals in future episodes. But for now, Congress focused on what it could pass and punted on what it couldn't agree to. Here's where the story gets a little bit complicated. While Congress rejected many proposed cuts to health agencies, it also gave HHS significantly more funding than the Trump administration itself had requested. On paper, that is a win. More money for public health, research, and federal programs is a good thing. But under current leadership, many clinicians and advocates are uneasy. Why? Because Senator Kennedy has already moved aggressively to reshape vaccine policy, public health messaging, and scientific advisory processes. Critics worry that additional funding without clear constraints could be used to advance agendas that undermine evidence-based medicine and public trust, ultimately harming patients. Some lawmakers have privately acknowledged the tension. They wanted to protect agencies like the CDC and NIH from deep cuts, but they are also concerned about how expanded resources might be used under the current leadership. It's a paradox for sure. Defunding public health agencies would harm patients, but funding them without guardrails, transparency, and oversight could also harm patients if resources are redirected towards policies that contradict established science. The concern is not theoretical. We have already seen major disruptions to vaccine advisory committees, public health communications, and longstanding norms. We'll obviously keep this in mind as we see what HHS does throughout the year and continue staying vigilantly on top of all of these developments. So, what should patients take away from all of this? Well, as always, advocacy works. Telehealth extensions, PBM reforms, hospital-at-home programs, these did not happen by accident. They happened because patients, clinicians, advocates, and organizations like GHLF stayed engaged. Second, funding alone is not enough. How money is used matters just as much how much money is allocated. Patients should care not only about budgets, but also about governance. Third, vigilance is essential. The bill buys time and preserves access in key areas, but it does not resolve deeper debates about health policy direction, scientific integrity, or coverage affordability. Those fights are still to come, and we'll be here fighting them at GHLF. At the Health Advocates, we believe patients deserve clarity. This funding bill contains real wins, real gaps, and real risks. It shows that Congress can still act when pressure is applied, but also that health policy decisions are increasingly shaped by power struggles far removed from exam rooms and pharmacy counters. As always, we'll keep watching what happens next, not from a political lens, but from the perspective that matters most, patients. Before we wrap up, a quick reminder, even in February, it's still not too late to get your flu and COVID-19 vaccines. Staying up to date on these vaccines will help protect you, your loved one, and your community as we continue to deal with influenza and COVID-19 viruses circulating. To learn more about vaccine recommendations and find reliable resources for patients, visit ghlf.org/vaccines. Thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.